Hey folks, we're back. I'm your host, BKP. Good morning from Sycamore Crossing, downtown Blue Ridge. Beautiful morning, and it's time for Ask the Doc. And we're joined this morning, Dr. Raymond Tidman, sitting in for Dr. Whaley. How are you, sir?
Very good, very good.
We want to thank North Georgia Cancer Research Center for affiliated with Northside Hospital for this segment. So we haven't seen you in a little while. Anything new? I'm putting you on the spot. We haven't seen Dr. Tidman in a little while.
Nothing major.
Nothing major?
Nothing. I mean, I've been stuck and poked and prodded a lot lately, but I'm doing okay.
Okay.
I've been hanging out with my profession from the other side, so.
I get it. So we sent you over some questions, and we got some questions. And I will tell you this, Josh and I both were talking earlier about this first question, and we didn't realize that this is actually, I don't want to say real, but something we were caught off guard. Our first question is Epstein-Barr Virus. And it comes from a viewer that says Epstein-Barr virus affects roughly up to 90% of the population, yet why does the medical community ignore it? That's the question directly.
That sounds like an angry question, but...
I don't know, but that is the direct question from the viewer that wanted to know...
well, here, let's go through the background. EBV, Epstein-Barr virus, is one of the herpes viruses. That herpes viruses are one of the most common viruses on the planet. We all swim in viruses and bacteria. They're all through our body. They're on our skin. Funguses are on our skin. So we live. There's probably more foreign DNA inside of our bodies than our own DNA. So, the statement that lots of people have it is true, but a lot of us have lots of things. I mean, there's numbers that say maybe 90% of people will at some time in their lifetime run into CMV virus. When you're young, you get mono, that's CMV virus. You get really bad sore throat and feel fatigued and run down. Your spleen gets enlarged. They won't let you play football. You get in a car accidents, bad things happen. So it's a common infection, but it's not being ignored. The problem is that we don't have adequate treatments for viruses. We don't. We have antibiotics for bacteria and antifungals for fungus, but that third microscopic organism, the most virulent, are viruses, and we don't have a way of treating it. So, you diagnose it, you tell people why they feel bad, eat well, drink lots of liquids, take Tylenol for fever, lay low, stay away from trauma. That's all we can do as doctors. So, it's not that it's being ignored, it's just not a lot you can do about it. For a young person that's listening, you get a really, really severe, super bad sore throat, and it's more than usual, and you feel just exhausted. Get in to see the doctor and find out if it is CMV virus, and try not to spread it.
So virus in itself, and there's different viruses out there. Virus in itself is something that can be slowed down, but we just really don't have.
You try to keep the immune system, the person healthy, so their immune system can whip it. But a lot of times it kind of goes indolent. It kind of goes into the body and hangs out. So people can present later on with like an appendicitis, and it's just swollen lymph nodes in their stomach or in their abdomen that are fighting that virus. So it's, there's only one cure, and that's for the individual to get healthy enough to overcome it.
All right, so, the question is, and I say this, not that I don't know that the medical community ignores this virus, but I think the viewers wanting to know why is there not more attention paid to it would probably be the direction. And
it's like so many frustrating things, and we're making so many advances in medicine, but overcoming viruses, not a lot of progress there. Vaccines, you have this idiot movement to put down vaccines. Well, vaccines are the way to prevent some virus infections, and they're useful vaccines. So, but once you get the virus, it's got to run its course, and you got to whip it yourself.
All right, let me go to the second question here. I appreciate that, and we always thank you for your questions, and you can send those. All you have to do is info @fetchernews.com. Put in the subject line "Ask the Doc" and send your questions. And again, we thank Georgia Cancer Research Center, affiliated with Northside Hospital, North Georgia Cancer Research Center, affiliated with Northside Hospital, for the segment. Dr. Raymond Tidman sitting in this morning for Dr. Whaley. Here's our second question, and this one is an interesting one to me, because I'm going to say I don't know who the viewer is that sent this, but I will step out there and say personally, there's a member of my family dealing with this right now, so I don't know who sent this question. I just want to make sure, because that people know I didn't write the question. I guess that's what I'm fumbling around to say.
Yeah.
But it is personal to me right now. I was recently diagnosed, not myself personally, I was recently diagnosed with lymphoma. Is this type of cancer caused by genetic factors, and are other members of my family at risk?
It's a very timely question. Sometimes in our practice we have these startling cases come in, and they're like worst case scenarios. And just last week I had a fellow come in. He's 70-ish. He's a guy, healthy all of his life, no major medical stuff whatsoever. A few weeks, I'm not going to name a name, but a few weeks ago, actually a month ago, he started feeling some enlarged lymph nodes in his neck. And he was a little alarmed by it, enough that he thought, I should go get this checked. So registered that this is something unusual. But he's like, I'm going on vacation. It's a very important vacation. I'll be gone for 2 weeks. They'll want to do a lot of tests. They may want me to cancel my vacation, so I'll just wait. So he's back from his vacation, makes an appointment, comes in to see me. Whole time I'm talking to him, I'm staring at his neck, because his neck is massive.
Right.
And sure enough, on exam, he's got these massive lymph nodes up and down his neck. And we've sent him off for a biopsy. I've not gotten the results back. This is how fresh this is. But I'm pretty doggone certain this is severe advanced lymphoma.
No, wait a minute. I want to stop there. Don't take this wrong.
Yeah.
Because, like I said, I know a little bit about this here recently. You said severe advanced.
But severe
lymphoma.
and advanced.
Now, I know
Advanced
you
is
don't
the
have
word.
the testing back, but
Right.
there's a reason why you framed it that way.
Well, it's coming on fast and hard.
I mean, is this lymphoma, or does it come on fast and hard?
Well, the fact that it's coming on so fast and hard means that it's an aggressive lymphoma.
Okay.
Now, there are three kinds of lymphoma in general. I mean, there's some other nuanced ones. There's Hodgkin's, non-Hodgkin's, and CLL. Hodgkin's, younger age people. I had a classmate in high school, died from it in college. Non-Hodgkin's, middle age, up through older folks. CLL, chronic lymphoma, older folks. The question is back to, I have a relative with lymphoma. Is there anything I can do about it? Of those three, in this order, it's like a 1.5 increased risk for Hodgkin's, 1.5 fold increased risk, 3 for Hodgkin's, 3-fold increase for non-Hodgkin's, and 8-fold increase for CLL. Those are genetic predispositions. Okay, so there are family trends that say, yeah, you can get lymphoma. But we always come back to, is there anything I can do about it, right? So if I'm going to order a medical test, particularly a genetics test, because these tests can run $4,000 or $5,000. They're not cheap. What am I going to do with the information? So if I could do a test that says, okay, somebody's going to get colon cancer, well, if I see genetically they're predisposed to it, then I can say, well, okay, we need to get you screened more often than the general population.
Right.
If I can show a test that you're going to get ovarian cancer, the lady's past childbearing, she might say, I'll take my ovaries out. Okay. Well, you can't take your lymphatic system out. You live on that.
Right. Okay.
So what am I going to do with the results of this test? Right. So it's a good question. Can I be more genetically predisposed because I have a parent in there? Yes, you can. But what can you do about it? Not much. You know, if you get a big swollen lymph node or something in your groin, your elbows, your armpits, neck, get it checked sooner. But there's no way you can take your lymphatic system out. Does that make sense?
Yeah, let me get this and see if I'm going the right direction. It is possible genetically that you are subject
Coming from
to
your family.
lymphoma.
Right.
But if you are, it's coming. It's what I say.
You're predisposed.
What you're saying,
there's no actually there. We don't have a genetic test.
No, not that it's coming, but if you are going to have it, you don't have the option of like taking lymph nodes out and things like that. You can't do that.
Right.
Other, like you
can't
explained,
prevent it.
Cancer, other cancer like colon, like ovaries, you can make decisions on that.
Right.
This is not something you got to.
You just have to be aware early.
Right.
And
all right. Well, how do you become aware early?
Okay, so symptoms of lymphomas, like many cancers, but lymphomas in particular, are swollen glands, swollen knots that you can feel, may or may not be tender, and just loss of appetite, fatigue, feeling generally run down. Okay. Well, a lot of us get fatigued and run down, so you don't necessarily go to the doctor every time that happens. But if you start, losing weight unintentionally, and you're really, really run down, and you've got a couple of swollen lymph nodes, get in to see the doctor. Because you can treat it, and the sooner you treat it, the better. So there is that side of it, So being aware, hey, Uncle Bill had non-Hodgkin's lymphoma. I just heard on the radio that I have a 3-fold increase. So that doesn't mean. How do you read that number? So if 1 in 1,000 people get that disease and they have a 3-fold increase, then that's 3 times. That's 3 in 1,000 in that family. It's not a big, humongous number.
But it did. So if 1 in 1,000 is open to that, or possible to get lymphoma, if it genetically,
in that family,
right? Genetically, you just went 3. So it's 3 in 1,000.
Right.
So, but you did go up. Because of genetics.
Right.
There's another case, and I understand you can't talk about this one, and you're waiting for some testing to come back. There's another case that is near to me. That, see, the reason I got onto that is because when you said, and I don't want to quote you, rapid
serious.
Right.
Yeah.
Is there a part where lymphoma is growing, and I don't know the proper words to say, and then it takes off and becomes rapid, like is
Yeah, I think it more depends on the strain.
Aggressive.
Right. Some of us get prostate cancer, and we may have a really aggressive, virulent form of it, and some of us get prostate cancer, and we're going to die from something else. I mean, it's going to annoy us and affect our symptoms, but it's not going to take us out. It's just not that aggressive. So this gentleman presented with a very aggressive tumor, and that's what I'm trying to say there. So, and let me digress one other thing about genetics on this. So let's say you've come from a family that's predisposed, and that you also worked around radiation when you were younger, or you had another kind of cancer when you were younger and you're on chemotherapy and that suppressed your immune system, or you had other things that suppressed your immune system. Well, your odds are going to go up further with that. So vocation and environmental exposures can further predispose you to lymphomas or aggressive lymphomas. So it's not all genetics. We don't really know exactly why it happens, but we know there are combinations of things that make it even worse for you.
Well, I don't want to get into the fear of overreacting, obviously, because we talked about being exhausted and some of the signs, lymph nodes. But if this is something or you feel there's a problem, don't wait. Don't go on that vacation. Don't say, I'll get it next month.
Yeah. And in this case, I'm not sure about the individual. Maybe he worried the whole time he was gone. Maybe that affected his vacation. It's his life and his choices, and that's what I support, is for people to make their own choices and live with what they want to live with. But the biopsy is not a hard thing. They numb you up, stick a needle in, take a little core biopsy out, or they go in and cut out lymph nodes, send it off to the pathologist. It's not, to diagnose it's not a big deal. That could have been in process while
you're on. Let me ask you one more thing, because you can go online and you can look at the body and you can type in lymph nodes and it'll show you everywhere. Mm-hmm. We tend to think, and let me just clear this up we tend to think like when I was young, my mom would check my swollen glands, right?
That's what she's checking.
Right, swollen gland. we tend to think that's it, but these are all over the body.
Right, but they tend to occur in clumps, and those clumps tend to be guarding certain parts of the body. That's the way to think about it. So your lymphatic system are these lymph nodes and your spleen. Those are the major immune organs that are filtering fluids, and they're on surveillance for viruses and bacteria. So, when we're kids, we're running into sore throats and strep throats and all viral sore throats. Well, we get swollen lymph nodes. Well, our moms are looking at our face and our neck all the time, so they see that or they feel it or whatever. Ladies that get breast cancer, they may have a lump, they may not feel the lump, but they may feel a lump in their axilla, in their armpit. Okay, you could have a skin cancer on your hands because our hands get a lot of sun exposure. Well, you might have a lymph node, right here in your arm. So there are different areas. The groin, you can get lymph nodes there from different things. So that's one of the things the doctor is looking for when they do their exam, is to, particularly if you've got a swollen gland or you're complaining of that, they're looking downstream. What's causing this? So,
well, Dr. Tidman, we appreciate it. And before we close this segment, you do know I'm going to put you on the spot and ask you if you have maybe a little joke. Do you have anything?
I have two. Actually, I have two.
Oh, all right.
Well, they're short, but this is the Ask the Doctor segment. So these are Ask the Doctor, like personal questions.
Okay, let's go here.
This lady asked the doctor. She said, how do I know when I'm getting old? And the doctor thought for a minute, and he said, do this. Just go fall down in front of a bunch of people. If they laugh at you, you're young. If they come running to help you, you're old.
I don't know. I got it. That's pretty good. All right, give me
the other one. The second one is the fellow that came in. He said, "Doctor, how come those adult diapers you ordered from here called Depends?" And the doctor thought for a minute. And he said, "Well, sir, it's like this. You're a young baby, young little boy. You're pooping and peeing your pants. The ladies are still going to be loving on you and hugging on you, so they're called loves and hugs. You're an adult man and you start pooping and peeing your pants, it depends on who's in the will."
All right. Whoa. Loves and hugs. Dr. Tim, I appreciate it very much. Thank you. And don't forget, if you have a question for Dr. William Whaley, he'll be back next week. We appreciate you filling in. We want to thank Northside Hospital, the North Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. You can find this segment on our YouTube channel, Ask the Doc. You can share all this information with your friend, and that is FYN TV, Fetch Your News YouTube channel. And you can share this playlist with your friends. Go there, check out Ask the Doc. You have a question, send it to info@fetchyournews.com. Ask the Doc in the subject line. Again, thank you. Hey, right after these messages, about 3 or 4 minutes here, we're gonna be talking about the rodeo, Blue Ridge Kiwanis 2019 rodeo, right after this. Josh, take us to break.